Hi, I am Tashika Thomas. My partner Amy and I have bilingual speech language pathologist services. I have the first three questions, and the first one is who is eligible for this program, services, and support? So, according to the research, it starts from birth through age 21. There are five answers. So, A is children with developmental delays, speech impediments, articulation, difficulty saying words, fluency, stuttering, or voice resonance issues. B is school-based eligibility, students whose communication disorder negatively impacts their educational or functional performances. Language, difficulty understanding others, receptive, or sharing thoughts and ideas, expressive. C are adults. Individuals requiring rehabilitations due to strokes, traumatic brain injury, dementia, or cancer such as larynx or tongue cancer. Specific conditions, feeding and swallowing, which can be congenital or acquired. Aphasia, dysarthria, apraxia, and dysphagia. Stuttering, voice disorders, or swallowing disorders. And component E, developmental disabilities, challenges with the social use of verbal and nonverbal communication, common individuals with autism, or in some cases, those receiving Medicaid waivers. Question number 2 is, who is qualified to provide this service program support? So they need two things to be able to provide this service. A is a professional educator's license, a PEL. Additionally, speech language must hold a state license under the Illinois Department of Financial and Professional Regulations. And B is education, a master's or a doctorate degree in speech language pathologist from an acquired institution, and they have to be able to pass the state licensure test. And question number 3 is, how does a student and their family access this service? So, and what is the process? So in order to process it, they have to go through a formal process governed by IDEA. And the process is, number 1, identification and referral written request. So you have to put a formal request in, whether it's through the school, the process, like when we do evaluations, or if it's through like the doctors or, the families. Documentation includes specific details about the child's struggles, such as difficulty to be understood. Number 2 is assessment and planning. So once a family gives their consent to the screenings, they have 14 days to decide if an evaluation is needed. Number 3 is the actual evaluation. So speech and language pathologists will conduct a formal assessment, may include standardized tests of speech and language skills, classroom observation and review of academic work, interviews with parents and teachers. Schools have 60 days to complete the evaluation after the family signed their consent form. Number 4 is eligibility meeting. So the eligibility meeting consists of the family and all of the specialists who they deem qualified to do a determination, such as a speech and language pathologist, the child itself too. Number 5, program supports. If they determine that the child is eligible, most common routes for speech therapy is outline specific measurable goals, the frequency of therapy, like whether the service will be individualized or in a group. Or they may give the child a 504 plan If the student has a disability that does not require specialized instruction, providing classroom accommodations.
Some of the program benefits for the bilingual speech language pathology program is the evaluation. Students receiving a bilingual SLP evaluation will who have suspected communication disorders will have this evaluation lead to services. These services will therefore be identified in an individualized education plan. If they demonstrate a communication deficiency, they will receive an IEP, which can be protected through the lifetime. These services be protected through the lifetime of the IEP. Third, therapy. Students receiving targeted interventions to address any communication issues. Having a bilingual SLP service program provider will remove the barrier to access if provided in the student's native language. Finally, mitigation. With bilingual speech language pathology services, students will be evaluated in their native language. This will mitigate the risk that multilingual learning students often face in being underdiagnosed or overdiagnosed due to English language learning capabilities and not necessarily disabilities. A student profile that we have prepared for you is that identifies the benefits is specifically for multilingual learners who have a communication disorder such as stuttering, impaired articulation, language impairment, or voice impairment. Really, any multilingual learner referred for an IEP would benefit from a bilingual SLP. A quote that we have from U Chicago Consortium research is that 4% of English language learning students were identified as having a speech and language disability. Some of the drawbacks. In Illinois, bilingual speech language pathology services are typically provided by the school district. However, SLPs are facing stifling caseloads across the state. This leaves several schools and their families to reach out to third party contractors to conduct evaluations and provide any therapy supports. Many families do not have access to third party contractors and are therefore left to rely on their school district or the state to provide any such services. Thank you for watching. This has been a presentation by myself and Tashika on bilingual speech language pathology.